Welcome back. September is Prostate Cancer Awareness Month, a time when doctors hope men will pay closer attention.
This year, thousands of men will be diagnosed with a cancer that shows up on a simple blood test. In tonight's Health News to Use, Karen Larson shows us one man's diagnosis and the treatment that led him from Norman to Tulsa.
You have your number, you know that.
Richard Smith admits he's stubborn, ignoring 2 years of blood tests that warned he may have prostate cancer. Then his doctor's third test.
Well, he still persisted. He says, I'm right, I still want you to go to the urologist.
Another test and biopsy confirmed Richard had prostate cancer, and 3 options.
Which were radiation, operation, or wait and see. Well, my family was going to have no part of the wait and see.
With his wife and children behind him, Richard researched treatments and hospitals.
Operation, you can have side effects, loss of some functions, which is kind of important to us men to have those functions working.
He decided on radiation at Cancer Treatment Centers of America in Tulsa.
We knew we were in the right place. Everything was smooth sailing after that initial shock of walking through the door and knowing where you're at, what you're there for.
An entire team of doctors assigned to his case, overseen by Medical Director of Radiation Oncology, Michael Payne.
This machine is very precise, allows us to focus in on cancer, and is one of the many things we use to treat prostate cancer.
Dr. Payne says this new technology offers patients better outcomes and fewer side effects. The key is early testing with a simple blood test starting at age 50 for most.
And men who have high risk with a relative who has prostate cancer, or the doctor thinks that they may have prostate cancer, should get tested earlier at age 40.
Richard's radiation procedure went very well. His follow-up tests offer good news.
Everything has turned out wonderful. I had no side effects. So I think we made the right decision, had great people, great doctors, nurses, and the whole staff working on me.
He's glad he followed doctor's orders and hopes other men will too.
Just go in and see your doctor. It's better to know early, because early we can take care of it than later.
Karen Larson, 2 Works for You.